So we're going to end with a sort of lightning round where I'm going to ask each of our panelists to tell us like a short sort of takeaway, lesson, solution, something that you think emerges from this conversation that you want to keep thinking about and you want our audience to keep thinking about. And Bob, can I start with you?
Yeah, I'm simple. We need a independent rating of policies, which basically gives you a star and says if something terrible happens to you, it'll cover it. I have very little use for this physician information. The average physician time is 15 minutes with a patient. There are 50 different policies out there. The doctor who's trying to figure out what you should do is not going to decide if Aetna 5 or Blue Cross 4 is right for you. But we need a certification. Secondly, I got to defend people who are at home. We're sending everybody home, and the people who are answering us have the thrill of their home care news system being their daughter, their spouse, their brother, etc. If we're going to send these people home, we better have Bob's system, because we have people who have to cut back their lives. Because mama's coming home. Why do I talk about this? We're about to have the largest population ever in U.S. history over age 65. If you have a parent, good news. In our study, you're about to become a primary caregiver. And so unless we can put Bob's type system in here, we are not going to be protecting a lot of people as we send them home. They need X hours of time. So we need something that protects those family members, and we need a certification on an insurance policy. And that is a public responsibility. I don't care if it's a local fire department. But somebody has to put a stamp on it and say, don't worry about the 54 pages. It'll protect you if you buy this policy.
And mine will be very short. If you want innovations and you're not finding them in your local academic medical center or wherever else you're practicing, bettercareplaybook.org is the Six Foundation website where we're collecting these evidence-based innovations. Community health workers with telemedicine, CCA I believe is in there, but there are a lot of models of care growing up outside of our sort of traditional academic centers that are available to people.
So, and very, very quickly, through the decades of my career, most or all of the innovation tried to occur on the insurance side. Case management, demand management, disease management, all failures. I don't know how much money was spent on all of that. The name of the game is care system redesign, and it's a values redesign. And Toyin really speaks to it unbelievably eloquently. In fact, it's such a pleasure to hear her. And I actually see the future of spreading Toyin, force multiplying Toyin across the country.
All right, Toyin, take us out.
I think speaking to aspiring clinicians, health system leaders, or people who are in that role, I think the name of the game for me is just ask patients, how much is this going to cost you in every aspect of the word cost: time, self-esteem, social relationships, dollar bills. We have to systemize asking, because what we find here is that if we don't ask, we can't mitigate and we can't intervene. And then that person who shows up, who's not taking their medications, who gets labeled as non-compliant, is struggling with poverty. And we can address that. We just need to ask.